What's up, guys? This is an anonymous post from somebody who is an advocate of medical marijuana for a mental illness, a series of mental illnesses. And I would like to just pop this up on YouTube and let anybody else out there know my story. I was a professional healthcare provider for several years, completed rigorous training, high scores in graduate institutions, and therefore I am smart. I know how to study. I am a medical professional. I have a degree in the medical professions, and in my late 30s, had what they referred to a manic episode. I was going through a divorce, and the demands of running my medical practice were extremely heavy at the time, and my children and family obligations and financial obligations to the bank and student loans and everything like that all of a sudden hit me hard, and I went into the hospital for my first stay. My very first manic episode in 2012. I had a approximately 30-day stay in the hospital, was put on lithium, zyprexa, several other medications that helped me sleep. Never before had I experienced anxiety. I was at that time diagnosed as bipolar type 1, currently in a manic episode. Was on lithium and zyprexa for about 6 months, and decided to cold turkey quit zyprexa. Cold turkey quitting zyprexa was a necessary evil for me, because I had to go online and read that nobody had cold turkey quit zyprexa, and nobody knew if it could kill you or not. So I cold turkey quit zyprexa. Nothing happened to me. Don't be scared, you're not going to die. Zyprexa will make you fat, it'll make you lose your hair, it'll make you grow tits, and it'll make your genitals small. So I wasn't a fan of zyprexa, so I quit that. Still remained on lithium for a while, until they put me on something called Latuda, which has been just fine. Now I'm on Latuda, Valium, and a sleeping medication, and I have been able to successfully cut down significantly on my Valium usage through the use of medical marijuana. I've used several different strains of marijuana, and this is the tough part. When I was in bed for 3 years, I was seriously depressed and did not want to try marijuana for my condition. I was scared that it would make me more depressed and more suicidal. Then I heard about a strain called Charlotte's Web, which had no THC in it. I also, in addition to being diagnosed bipolar type 1, I also have PTSD and herniated spinal discs number 3, 4, 5, S1 with surgery as well. So I have chronic pain and mental illness as well. So I heard about Charlotte's Web, and I started smoking it, and Charlotte's Web was something that helped me kick my depression. And of course I did not quit my medication, and I'm not advocating anybody quitting their medication, but seeing your doctor regularly is very important. Seeing your psychiatrist is very important on a regular basis, monthly at least. And doing whatever medications they recommend, and then I smoke marijuana. I smoke some very, very select strains of marijuana. I'm not just out there smoking any old street marijuana on the street. Charlotte's Web, as I mentioned, is very hard to get hold of, and I also have been using sour pink grapefruit and OG Kush. Critical mass was just way too much for me and put me into a depression. Sour pink grapefruit seems to be doing great for me, and as well as Charlotte's Web. So that is my story. I am now able to function regularly. I wake up at a normal hour. I go to sleep at a normal hour. I'm enrolled in school. I am retraining to change my life and to be in a different profession, and I am not holding down a job, but am married and am making it go right now. So, better than being in bed, better than being sleeping in bed all day with depression and anxiety and PTSD, laying there in a fit, staring at the ceiling, wondering when I'll have enough courage to blow my brains out. Now life is enjoyable and things are going well. So if there's anybody out there considering marijuana, please just don't smoke any marijuana. Start out with Charlotte's Web and kind of wean yourself into a indica type of a plant that has a lot of CBD in it. Some good strains would be the sour pink grapefruit again that I have mentioned, or the OG Kush. Again, thank you very much. Hope this helps you.